Hi, I'm Dr. Steve Grinstead, author of the book Freedom from Suffering, A Journey of Hope, and developer of the addiction-free pain management system. Today I want to start with a question: to medicate or not to medicate? Can pain medication actually cause problems with chronic pain management? Well, there's a lot of controversy on this topic. There's one faction that says as long as people are taking their medication for appropriate physiological pain, they won't be addicted. Now, unfortunately, this is true in the majority of the cases, but for a significant portion of the population, especially people with genetic or environmental risk factors for an addictive disorder, this could not be a bigger problem. So, one of the big problems is there's a lot of misunderstood terms. I've known a lot of patients who were afraid to take their opiate medications because they thought they were addicted to them. I've seen some healthcare providers or family members fear that the person that's been on opiates for a long period of time had become addicted because if they stop taking their medications, they go into withdrawal. Well, there's a big difference between addiction, medication abuse, tolerance, physical dependency, and pseudo-addiction. All these terms really need to be understood. I'm going to invite you to go to my Addiction-Free Pain Management blog where you can see the link below this YouTube video, because it's really important to get some clarity on these terms. Because anyone taking certain medications over a long period of time and then stopping them suddenly may have a problem. Let's take a look at another medication that's not related to chronic pain, but it's diabetes. Some people are on chronic insulin maintenance. They have to take the insulin every day to keep their diabetes under control. If they stop taking it suddenly, they can have some severe health problems. Well, it's the same with some of the pain medications. If you stop some of the opiate pain medications suddenly, if you've built up a tolerance and you've been on them for a while, you'll go into what's called withdrawal. Your body will get sick. You will have the worst case of the flu in some cases you ever had. Many people feel like dying when they have this. No one's ever died from opiate withdrawal, by the way. They just wish they would. So we need to explain these misunderstood terms to people. And tolerance. Tolerance is another misunderstood term. Sometimes people taking medication need to have their dose increased periodically because the brain and the body adapts to the medication. This is tolerance. It takes more to get the same effect. Or if you take the same amount, you get a reduced effect. And then there's dependency. And we've talked about dependency. It means that if you get dependent on the medication and you stop it, you'll get sick. Then there's a condition called pseudo-addiction. And basically, pseudo-addiction is undertreated or mistreated chronic pain. A lot of times the symptoms look really similar. For example, a person may be overly attached to their medication. They may obsess about it. They may run out early between appointments. They may lose their medication and need more. They may start needing more and more and more as tolerance builds. However, once the pain gets addressed adequately, a lot of these other symptoms go away. Now, addiction is a really interesting phenomenon, because if someone becomes addicted to the medication, not pseudo-addiction, but addiction, and they form an attachment to that medication, both biologically, psychologically, socially, and spiritually, that they will not be willing to let go of the medication despite experiencing severe problems, medical problems, family problems, legal problems, any kind of problems. This is addiction. So we need to help educate people about the difference. The other problem is these opiate medications were never meant for chronic pain. They were developed for acute pain. There are a number of my patients, however, that are taking chronic opiates at reasonable doses. It improves their quality of life and their level of functioning, and the side effects are minimal. What's the problem here? A lot of my addiction colleagues get really scared. On the other hand, though, there's a lot of pain providers out there that have a mistaken belief that just because somebody has physiological pain and they're taking the medication that's prescribed by a licensed provider, that they will not have a problem. And for a lot of people, as I mentioned earlier, this is just not true. One of the things that I know is knowledge is power. The more people know about their pain management, the medication, and what it takes besides medication to have effective chronic pain management, the better off they are. But there's also a saying by Khalil Gibran, a little knowledge that acts is worth infinitely much more than all the knowledge in the world that is idle. So gain some information and put it into action. And please check out my blog. Thank you.